Right now I am going to prepare my lunch for tomorrow. I will actually just bring the leftover food that we have. So I actually made some beef broccoli and rice, so that's what I'm going to take tomorrow for lunch. I'm just gonna bring some yogurt with granola and blueberry on it. Just gonna put like a handful of blueberries, and then we're gonna put the granola in here. And for breakfast, I really couldn't decide what I'm gonna eat, so I usually just make some egg omelette. I don't think I have tomatoes available right now, so probably I'm just gonna mix it with mushrooms and spinach. So that's my breakfast, and a slice of bread, or maybe just a cup of coffee. I forgot that my husband got me this one, so this one and some egg. That's going to be my breakfast. I'm just trying to catch up with you guys on what's going on with my, nursing journey and my week. So it's actually almost 10 o'clock in the evening right now, and I'm going to work tomorrow. So I was trying to finish off this Med Surg drug calculation test, so I will be able to access the pyxis where all our medications are stored. So I'm finally done. I actually did part of this while I was doing the EPIC training, but I wasn't able to finish it. So finally I'm done. So I'm gonna show you. So yeah, this is it. So I hope everything is correctly answered. I hate dosage calculation. Like, it gives me a lot of headache. But yeah, just for me to be able to access with pyxis. So finally, I'm done. So I'm hoping tomorrow I will have some access. So I'll be working tomorrow, and then tomorrow is Tuesday, and then I'll be working on Wednesday, and then I'll be working on Friday. So I actually have a bunch of nurses report sheets where I can use during our reports. So basically I can fill up, the patient's information while we do a report. So I actually prefer this form the most, which is my preceptor is using. I don't know, it's just not very overwhelming. So this is what I've been using lately for the bedside report. Let me show you a clear picture of it. So basically you could provide the patient's information, the admission date, diagnosis of the patient, their code, if they are in isolation, if they have allergies, the activity of the patient, if they have oxygen, what IV are they hooked on, if they're on consults, what's the plan for the patient. And these are just about the history of the patients, any labs, anything that you need to do with the patient, INOs, sort of this stuff. So that's why I like it. It's not very overwhelming. This is my binder. So part of it is my orientation checklist that I need to perform and need to be signed by my preceptor. Yeah, so these are just the samples that I needed to do. I have a few skills that have been signed already. And as I've told you, I already tried to initiate some IV insertions, so I have already got it signed. Also, I did some insulin. I still gotta do a lot of medications. Aside from that, I have so many things that I need to read. These are basically our hospital protocols that I needed to learn. So I actually need to read again about the medications. I'm already familiar with it, but being a nurse, I'm afraid that I wouldn't be able to answer all the patient's questions. So I really wanted to take a few reviews about the medications and the protocols of the hospital, because it's very important. It's only been my second week, so basically it's my fourth shift. I'm kind of a little anxious again to go to work tomorrow, but I think I'll be fine. I'm basically talking quietly because my husband's already sleeping, but I'm gonna show you some of my stuff that I have that I brought with me to work, or the stuff that I have purchased for work. So this is one of the thing. I actually got this from Amazon, so I don't really use this. Literally a nursing clipboard. You know, I don't like bulky stuff, so that's why I bought this, and it's very handy. And this is my stethoscope that I bought from Amazon as well. I believe this is $118. I got myself some planner because I was trying to be consistent with this, just for me to be updated with my schedules. And also I got this pen, which is an erasable pen, which has color red, blue, and black. I also got this from Amazon. I also got this bandage scissors. It's all together with this, and let me show you. So basically, when I bought the bandage scissors, it's together. I have two pen lights. The other one I kept it somewhere, and then the highlighter and the what you call that, some marker, and the bandage scissors. And finally I have my new what you call this, badge, which says clinical nurse. Can you see how cute this is? Back and body hurts. I actually got this at Temu. I got the little tote from Amazon. I think it's 32 bucks. How am I gonna put this all together? I'll put my clipboard over here, my stethoscope, my planner, bandage scissors, pen, some lotion. Got some lotion with me, and my badge. Badge goes here. It's basically all in my purse right now. I also got this on Amazon. So it's basically an energy sticks. So I choose the Hawaiian Shave Ice flavor. I don't usually drink energy drinks, but whenever I needed one, I thought of just getting it into an energy stick. So basically I could just prep it whenever I feel like drinking it. So I feel like it's pretty handy. So instead of buying a can, so that's why I bought this. I think I found it on TikTok. So one of the nurses that I followed, and she had this, and this is only like $8.50, I guess, from Amazon. So I'm gonna give it a try, and I'm gonna let you know how it tastes, you know. So this too is going to be prepared, so I'm just gonna grab it tomorrow, and I'm gonna set it here so it's ready to be grabbed. So it seems like I have already prepared everything, and it's already 10:37 in the evening, and I'm just gonna wait till my husband's alarm's gonna go off so I can make sure that he's gonna get up for work, because he usually work around midnight. He typically gets ready around 11, so that's why I'm staying up late a little bit. What are you doing? DJ? What are you doing? He likes to sit in that spot. He's so weird. Oh, CJ. Daddy's sleeping? Huh? Daddy's still sleeping? Daddy's still sleeping? He gonna go to work. And I gonna go to work, and Kaden is not home. So, I have been trying to think about buying a figs scrubs, but it's just so expensive. But I normally get my scrub at Poshmark anyway. My workmate actually gave me a gray scrub, which is figs, and the size is extra small, and as I've told you, I gain a little bit of weight, so in the hip area it does fit me, but it's kind of a little tight. I don't like a really tight scrub. I like something like loose, and I'm comfortable with it. So I might be needing to buy a small size for figs. And I don't know, so far my favorite scrub was the one that I got for 20 bucks, which is a set. It has a it's a scrub top, scrub bottom, and then also have like a little scrub jacket or sweater. I don't know what it's called, but yeah, it's a 3 set of scrub, and I only got it for 20 bucks, and it's a really good condition. So I feel like it's a really good price. So I think it was a catch, and that was my favorite. And other than that, I also got another scrub, which is Dickies. How do you pronounce? Which is Dickies. Dickies. I don't know how to pronounce it, but yeah, Dickies. So it's a Dickies scrub, and it's also a jogger pants. It's also good. I only got it for $10. But normally you pay, if you get some stuff at Poshmark, you normally pay for the shipping fee. Sometimes the seller is going to give you a discount for the shipping fee, so I usually just pay $5 or $5 and something cents. I'm not sure how much is the exact amount, but normally you have to pay like about $7.
Step 1, wake up early, gonna rise with the sun. Step 2,
hey lovelies, good morning. So it is, what time is it now? 5 o'clock in the morning. I did wake up a little bit late, so I have to leave around 5:50 at the latest time of 6 o'clock. So I'll be there at least 6:40 in the morning, because I always want to be early, because my preceptor is really early, because she likes to read the patient's notes, which is really good, because I really want to do that as part of my routine if I'm free from orientation. So yeah, right now I'm just already icing my face, because I feel like I didn't have enough sleep, because I was trying to sleep last night, but I was just tossing and turning and I just couldn't sleep. So I don't know, maybe because I have been off for a long time, I've been sleeping late, and my sleeping pattern is messed up. So yeah, I'm icing my face. It feels really good. I already washed my face. I already put some vitamin C. Now I'm icing it, and then I'm just gonna put some moisturizer, and I'll be back later. So I'm actually ready. It's 5:45 in the morning. I didn't like to do my hair today. I don't know, but I did have some clip, so that's all I gotta do. I feel like my hair is fine, so I didn't want to do my hair right now. I usually take a shower and wash my hair at the evening. So yeah, already made my coffee. I'm about to leave soon. I'm still confused if I wanted a cold coffee or a warm one, but maybe I'll just stick to warm one. Hey guys, so I just got home. It's already 8 o'clock in the evening. So I had really fun during the shift, because we only had like total of 5 patients when we first came in. Everybody were kind of like a little bit stable. My preceptor had them yesterday. Anyway, in the middle of the day, we ended up to discharge 2 of our people. Nothing really serious. We have like patients that are in for cellulitis, cystitis, or UTI. Somebody was there for vertigo or some dizziness, and then COPD exacerbation, stuff like that. And then we got to discharge 2 patients. And then it was really fun, because I already have an access with Epic, which is really good, because I could already practice charting. So I did some assessment charting. When we give meds and we try to administer and pass some meds, I was able to do the charting by myself. Like, my preceptor just helped me through accessing all the medications through pyxis, because I don't have an access with that yet. But hopefully tomorrow, my manager just submitted a request for me to get a an access for the pyxis. Anyway, yeah, so most of our meds today are all oral meds. So we only have 1 patient that has an IV dose of antibiotics, which is the FILIPINO or MaxiPime. I gained a little bit of confidence today. It's really fun, and I'm so excited for tomorrow because I'm going to be able to have an access with pyxis. So hopefully I will be able to administer and give meds independently. Of course, I'm gonna talk with my preceptor if I'm not confident with a drug, but I will be able to, grab the medication out from the pyxis this time. So, which is, I'm climbing up, girls. So this is really fun. But anyway, thank you for being here. Hopefully I'll be able to give you some update tomorrow. I'll see you. Bye. So I have to get in the house from the backyard because my husband's already sleeping, and I don't want to startle him because every time I get inside the house, the dog, they're going to bark. So I told him just to leave the back door unlocked so I could get in. Anyways, I'm gonna take a shower and hopefully I will be able to sleep better tonight because I wasn't able to do that last night, and tomorrow would be another grind for another shift. So see ya. Oh my god, guys, it is 9:05 in the evening. I just got home. Actually, today was only my second shift, and it's been a crazy day. And knowing that we only have a total of 4 patients, and we had the same patients since morning until we ended our shift. So I'm just like so tired today. If you could see my face right now, I look so stressed. But yeah, it was kind of a little bit overwhelming today, but we finally was able to get done with our bedside report around 7:45 because around 7:30 we're still doing something. Probably not 7:30, probably like around 7:15, 7:20. We're still in the middle of something. What was I doing? I was doing an NIH stroke assessment with one of our charge nurse, just to make sure that her score or her level had went down. And it's something that you use to assess for suspected stroke patients. And then after that I had to pass some pain meds and some Qbanks with my preceptor. So it was a crazy shift. I did a lot today. I did the NIH stroke assessment. I tried to initiate an IV. I was able to find the vein. However, I was kind of a little bit nervous because I didn't want to hurt the patient because the family was at bedside, and I was like kind of anxious about it. So I was able to find the vein, although when I tried to initiate it, I was kind of like afraid to push it more because the patient was grimacing her face and verbalizing that it's painful. So one of the nurses that was with me has to continue it, but I was in the right vein, so we were able to flush it, and then it was patent. It was okay. I was able to push some Lasix, and I was able to, I think I was also able to push some Toradol because she had some headache, and I have to give her that for her PRN. Although after that, when we try around, that's the time when we were trying to, no, it wasn't Qbanks actually, it was Cifidi. I don't remember why it's an antibiotic, but I forgot the name, but I might be able to put it here. It actually get infiltrated, so we have to pull that IV out, and eventually pass it to the next shift that they have to do another IV insertion. So yeah, and I did some EKG. I'm not really confident with that, but I think I did great today. It wasn't that hard, but it's sometimes I think too much that I don't want to commit any mistake, and I wanted to be getting everything perfectly done. I'm kind of like a bit of perfectionist. So yeah, it's a tiring day. And finally, I have an access with pyxis. I could now get or take the meds out from the pyxis. What else did I do today? We had a patient that has impacted stool or impacted bowel. Unfortunately, I really wanted to de-impact it, but I was busy doing the NIH stroke assessment or scoring. So my preceptor was doing that, and I wasn't able to participate on that, although I was able to put some, suppository on her. Yeah, I'm having a headache. I did not end up eating dinner because I was kind of full. One of my workmates gave me some fries, and that's what I've been eating somewhere around 6 o'clock. I just want to take a shower and sleep. So tomorrow I'm going to be hanging out with my friend, going to take a walk in the park. I'm off tomorrow. Then I'll be working around Friday again, and that will be my third shift for this week. So good night, lovelies. I was just trying to check in and telling you guys about how my shift went today. And I hope you're having a good night and a good day. So I'm about to leave now. My husband told me that it's gonna be really hot today, and it is quite warm, so yep. So nice. I only have like oral medications, just the scheduled drugs and some PRNs, like let's say Zofran, pain meds, and mostly blood pressure medicine and antibiotics. Most of our antibiotics are also oral. We only have one patient that have an IV dose of antibiotics, which is the cifipime or the mexipime. That's all it is, which is an IV push. Other than that, everything is just oral or tablets. What else? So we were able to discharge one of our patients that had a gastric sleeve. She did really good. She was able to ambulate, so that's why we only keep them overnight. So that's why we have to discharge her. And we also had to discharge one of our patients that had vertigo or dizziness. I'm not sure how long was he in the hospital, but yeah, we were able to discharge him. And then later, around probably 9 o'clock, 9 o'clock in the morning, we had some med-stay patient. Med-stay patients are those patients that had alcohol and narcotics or some opioid withdrawals. So we got him around 8:30 and did an admission assessment with him. So it wasn't me who's been doing it, but it was my preceptor. We have this bunch of assessment questions that basically ask about their history and stuff like that. So it was my I was able to observe that. I'm not ready for that though, but I was able to do all the assessments with all the patients earlier, like listen to their heart sounds, lung sounds, GI sound. And I was also able to palpate the patient that had COPD exacerbations. She has cellulitis or edematous lower extremities, so I was able to score that on, of the swelling. Yeah, it was pretty fun today. So I did the assessment charting for 2 patients because we only had, like, as I've told you, we ended up discharging 2 people, so let's say we have 3 patients left. I was able to do the discharge planning of the other patient, and then I was able to discuss with him what he was supposed to do after discharge. So basically they are going to see, or they're going to have a follow-up checkup with their doctor or primary doctor, so I have to remind them about that, and also some certain meds or new medications that they have to take whenever they get out from the hospital. Also, we have to let them know if they develop any fever, any nausea and vomiting, or any rashes. What else? Cough or difficulty of breathing, stuff like that. These are just like what you call this, some signs and symptoms that if they develop that, these are some certain stuff that they will get from the hospital, so they have to go through the ER or call us right away. I was also able to do some care plan. I did 2 of our patients, and my preceptor said that I did really great. It was kind of a little awkward and hard for me because this is the first time that I was able to do all the charting. So of course, when I chart, my preceptor has to check it. She said everything's doing great. If you're studying for the NCLEX, don't give up. Study. Keep on studying. Pray too. If you're, whatever you're studying, if you're in a CNA classes, you can do it. If you're working while studying and, getting a higher level and you want to become a nurse, you can do it, guys. So I'm here to support you all the time, and you can do it. We're all in this together. Have a good night. See ya.